Someone just collapsed right in front of you. No warning, no explanation. They were standing there one moment and then they were not. Now they are on the ground, eyes closed, body still, not responding to anything you do. But they are breathing. You can see it. Faint, shallow, but there. No ambulance to call, no emergency room to rush them to, no doctor to diagnose what happened, no brain scanner, no blood test, no understanding of what consciousness even is or where it goes when it disappears. Just a completely motionless human being on the cave floor and an entire tribe standing around them with absolutely no idea whether this person is sleeping, dying, dreaming, trapped, somewhere between worlds, visited by a god, cursed by an enemy, or something else entirely that has no name yet. So, what did ancient humans actually do when someone would not wake up? Buckle up, because this story involves terrified tribes making impossible decisions, ancient people being buried alive by accident, the surprisingly sophisticated ways humans learned to tell the difference between sleep and death, coma rituals performed across every ancient civilization on Earth, the genuinely horrifying history of being declared dead when you were not, and one of the most emotionally powerful discoveries in all of human archaeology. This is the story nobody tells, and it starts 200,000 years ago in a cave with a person on the ground and everyone else holding their breath. Let's begin with the most terrifying problem ancient humans faced. How do you know if someone is dead? This sounds like a question with an obvious answer, but it is not. It was not obvious for most of human history, and getting it wrong had consequences so horrifying that they shaped burial practices, death rituals, and medical procedures across every civilization that has ever existed. Modern humans can check for a pulse with precision instruments. We can measure brain activity. We can detect breathing with equipment sensitive enough to register the faintest movement. We can perform tests that definitively establish whether a person is alive or dead. Ancient humans had none of this. What they had was observation, touch, sound, and a growing body of terrifying experience that taught them, very slowly, that the line between alive and dead was not always as clear as it looked. In the Stone Age, a person who collapsed and would not wake up presented the tribe with an immediate and urgent crisis. Was this person dead? Were they sleeping? Were they taken by spirits? Would they come back? Should the tribe wait? For how long? What should they do with the body if they had to move camp? These were not abstract philosophical questions. These were immediate practical emergencies with life or death consequences for the entire group. And ancient humans got it wrong sometimes. We know this because archaeology tells us so. Across multiple ancient burial sites, researchers have found skeletal evidence of people who were buried alive. Bodies found in positions that could only be achieved by a living person. Hands pressed against the inside of burial chambers, bodies turned over in sealed graves, evidence of frantic movement in enclosed spaces that were supposed to contain only the dead. These were not murders. These were mistakes. Heartbreaking, terrifying mistakes made by people who genuinely could not tell the difference between death and deep unconsciousness, and who did not know what to do with the uncertainty. The fear of being buried alive was so universal and so deeply rooted in human experience that it generated some of the most elaborate precautionary rituals in history. But we will get to that. First, let's talk about what actually causes someone to collapse and not wake up, because understanding what ancient humans were actually dealing with helps explain why they were so confused and so frightened. The conditions that cause unconsciousness and unresponsiveness are many. Epileptic seizures followed by the deep sleep called the postictal state, diabetic coma, traumatic brain injury, stroke, severe infection causing septic shock, extreme blood loss, heat stroke, hypothermia, carbon monoxide poisoning from sleeping too close to a fire in an enclosed cave, severe dehydration, snake or insect venom, toxic plant consumption, simple fainting from shock or blood pressure changes. Ancient humans had no names for any of these conditions, no understanding of the mechanisms behind any of them, no way to distinguish between a person who had a seizure and would wake up in an hour versus a person who had a stroke and would never regain consciousness versus a person who appeared dead, but was in fact in a coma that might last days or weeks. To them, it was all the same terrifying thing. A person who was here and then was not. A person whose spirit had apparently gone somewhere without their body. And that explanation, the spirit going somewhere, became the foundation of almost every ancient response to unconsciousness across every culture on Earth. Let's talk about what happened in the Stone Age first. When someone collapsed and would not wake up in a prehistoric tribe, the shaman was summoned immediately. This was not a situation for ordinary tribal members to handle. This was a spiritual emergency of the highest order. The shaman's first task was to determine where the person's spirit had gone. In prehistoric spiritual understanding, unconsciousness was almost universally interpreted as the soul or spirit temporarily leaving the body. The question was not what happened medically. The question was, where did the spirit go, and how do we get it back before the body dies without it? The shaman would enter a trance state through drumming, chanting, and sometimes the use of psychoactive plant preparations. In this trance state, the shaman believed they could travel to the spirit world and search for the missing soul. They would negotiate with spirits, fight off demons that might be holding the soul captive, and attempt to guide the wandering spirit back to the body it had left behind. While this was happening, the tribe had very specific responsibilities. Nobody was allowed to make sudden loud noises that might frighten the returning spirit away. Nobody was allowed to step over the unconscious person's body, which was believed to block the spirit's path back. The unconscious person had to be kept warm and comfortable, so their body remained a welcoming place for the spirit to return to. Food and water were kept nearby. Someone sat with the person at all times. The fire was kept burning to provide warmth and light for the returning spirit to navigate by. The tribe would wait, sometimes for hours, sometimes for days, and sometimes the person woke up. When this happened, it was treated as one of the most significant spiritual events that could occur. A person who had traveled to the spirit world and returned was considered permanently changed, marked, chosen. In many prehistoric cultures, a person who had experienced this kind of unconscious journey and survived became the next shaman. Their experience of traveling between worlds was considered the ultimate qualification for the role of spiritual leader. In other words, having a seizure or a stroke or a severe fainting episode in prehistoric times could get you promoted, which is a remarkable thing to sit with. Now, let's move forward to ancient civilizations. Because as humans became more sophisticated, their responses to unconsciousness became both more elaborate and more interesting. Ancient Egypt had an extraordinarily sophisticated relationship with the concept of consciousness and death. Egyptian spiritual understanding recognized multiple components of the human soul, including the Ka, the Ba, and the Ak. Each had different properties and different relationships with the living body. When someone collapsed and would not wake up, Egyptian priests and healers would attempt to determine which element of the soul had departed and where it had gone. The Ba, in particular, was understood as the aspect of the soul that could travel freely from the body, both during dreams and during unconscious states. Egyptian understanding actually distinguished between the normal departure of the Ba during sleep, which was considered safe and temporary, and the dangerous departure of the Ba during illness or injury, which might mean the Ba could not find its way back. This is remarkably close to how we now understand the difference between normal sleep and pathological unconsciousness. different states of the soul traveling, different levels of danger, different responses required. Egyptian healers also developed practical tests to distinguish between death and deep unconsciousness. They would hold a feather or a piece of fine linen thread beneath the nostrils to detect breathing too faint to see with the naked eye. They would listen with an ear pressed to the chest for a heartbeat. They would check for warmth in the extremities. They would observe the color of the skin and the lips. These were not infallible methods, but they represented a genuine attempt to use systematic physical observation to answer the question of whether a person was alive. The Edwin Smith Papyrus, the ancient Egyptian medical text we discussed in the illness episode, also contains descriptions of patients who are unresponsive following head injuries, with notes on examination and prognosis that show Egyptian physicians were attempting to assess the severity and likely outcome of unconscious states in a remarkably systematic way. They were doing primitive neurology without knowing anything about neurons. Now, let's talk about ancient Greece, because the Greeks changed everything about how humans thought about consciousness and death. Greek physicians, following the revolutionary approach of Hippocrates, began attempting to understand unconscious states as physical phenomena rather than purely spiritual events. They observed that unconsciousness following a blow to the head was different from unconsciousness following a fever, which was different from the unconsciousness of epilepsy. They could not explain the mechanisms, but they recognized the patterns, and pattern recognition was the beginning of everything. Greek physicians developed more sophisticated methods of assessing unconscious patients. They would attempt to rouse them using sound, touch, and strong smells, including burning feathers and sharp aromatics held beneath the nose. They would observe the quality of breathing and the color of the face. They would check for responses to painful stimulation. This last technique, pressing firmly on the sternum or pinching the skin to produce a pain response, is still used in modern emergency medicine today as a basic assessment of consciousness level. The Glasgow Coma scale, which modern doctors use to assess unconscious patients, is built on exactly the same principle of testing responses to stimulation that Greek physicians were using over 2,000 years ago. Ancient Greek physicians were also the first to begin documenting that some people who appeared to be dead were not. The concept of apparent death, a state in which a person appears deceased but is not, was recognized and discussed in Greek medical literature. This recognition generated significant anxiety in Greek society and contributed to specific burial practices designed to prevent premature burial. Greek custom typically required a waiting period of several days before burial. Bodies were kept in the home and watched over continuously. This was partly a mourning ritual, but it was also a safety measure born from the knowledge that people who appeared dead sometimes were not. Now, let's talk about ancient Rome, because Roman responses to unconsciousness included some of the most dramatic and occasionally hilarious practices in ancient medical history. Romans were acutely aware of the danger of premature burial. Roman law actually required a waiting period before burial could take place. The body had to be displayed for a minimum of 7 days in many traditions. During this time, family members would call the person's name repeatedly and watch for any sign of response. The calling of the name was not purely ceremonial. It was genuinely believed that a person in a deep unconscious state might be recalled to consciousness by the sound of their own name spoken by a familiar voice. This is not entirely without basis. Modern neuroscience has found that unconscious and comatose patients sometimes do show measurable brain responses to familiar voices and their own names even when they appear completely unresponsive. Romans who could afford it also employed professional watchers called conclamators, whose specific job was to watch a body and call out if any signs of life appeared. These were not mourners. They were observers assigned to prevent the catastrophic mistake of burying someone alive. Rome also had the custom of the agiotrisectum, the cutting of a finger joint from the body before cremation. This was not simply ritual. It served as a final brutal test. If a person was alive, they would respond to this. If they did not respond, then burial could proceed with reasonable confidence. That is genuinely one of the most disturbing quality control measures in human history. Now, let's talk about ancient China. Because Chinese medicine developed one of the most sophisticated ancient frameworks for understanding states of unconsciousness and one of the most elaborate systems for attempting to treat them. Chinese medical understanding recognized multiple types of unconscious state and attributed different spiritual and physical causes to each. A person who collapsed following intense emotional shock was understood differently from a person who collapsed following fever, who was understood differently from a person who collapsed without any apparent cause. Chinese healers used strong stimulation techniques to attempt to rouse unconscious patients. Acupuncture at specific revival points was performed immediately on unconscious patients. These points, particularly a point called renjiang, located in the groove between the nose and the upper lip, were believed to be emergency revival locations where needle stimulation could call the spirit back into the body. Renjiang in particular is still used in modern acupuncture for emergency conditions. And interestingly, the location corresponds to an area that does produce a strong physiological response when stimulated, which may explain why this technique appeared to work often enough to become established practice. Chinese healers also use strong aromatic substances burned beneath the nose, vigorous massage of the hands and feet, and loud sounds directed at the ears of unconscious patients. All of these techniques have some physiological basis, and all of them appear in modern emergency resuscitation guidance in various forms. Ancient Chinese medicine also developed specific herbal preparations given to unconscious patients, either placed in the mouth if swallowing was present or burned as inhalable smoke to attempt to stimulate revival. Some of these preparations contained compounds that modern pharmacology recognizes as having genuine physiological effects on the nervous system. They did not know why these things worked. They just knew that sometimes they did, and they kept using them. Now, let's talk about the most terrifying chapter of this entire story, being buried alive, because the fear was not irrational. It happened. The historical record across many cultures contains accounts of people who were buried or entombed while still alive, and who subsequently made their presence known. Some escaped, some did not. Medieval Europe, which inherited both the fear and the uncertainty of ancient medicine, became almost obsessed with the problem of premature burial. Accounts of bodies being exhumed and found in positions suggesting post-burial movement terrified populations across the continent. Some of these cases were almost certainly the result of natural decomposition processes that can cause bodies to shift and move after death. But some were not, and nobody could tell the difference with certainty. This fear generated extraordinary responses. Waiting coffins were developed with bells attached to strings that ran down to the body's hand, so that if a person revived underground, they could ring for help. These were not mythological devices. They were real products sold to real frightened customers. The phrase "saved by the bell" may have originated from this practice, though historians debate this. Coffins were designed with breathing tubes. Tombs were constructed with speaking tubes running to the surface. In some cases, tombs were designed with internal locking mechanisms so that a person who revived could let themselves out. Entire societies were organized around the collective terror of this single mistake because they had all heard the stories, and they knew the stories were sometimes true. Now, let's talk about the thing that will genuinely surprise you about ancient responses to prolonged unconsciousness: the care. Because when someone fell into a prolonged unconscious state in the ancient world and did not immediately wake up, the response of the community was not to give up. It was not to assume death and proceed with burial. Across ancient cultures, when unconsciousness persisted and a person was clearly still alive but could not be roused, communities developed systems of sustained care that are remarkable in their patience and their tenderness. Ancient accounts from multiple cultures describe families and communities maintaining continuous watch over unconscious members for days, weeks, sometimes longer. Water was carefully administered. In ancient Egypt, medical texts describe methods of giving small amounts of liquid to unconscious patients by tilting the head and allowing drops to enter the slightly open mouth. This is a primitive version of the positioning technique still used today when oral hydration must be given to a patient who cannot swallow normally. Ancient healers across multiple cultures documented the importance of turning and repositioning unconscious patients to prevent what we now call pressure injuries or bed sores. They did not know why lying in one position for too long caused skin breakdown, but they observed that it did, and they developed practices to prevent it. They were doing primitive nursing care without any understanding of the physiology behind it. They were doing it because someone they loved was still breathing, and they were not willing to stop until the breathing stopped. In ancient India, Ayurvedic texts describe sustained care of unconscious patients, including specific massage techniques, aromatherapy, gentle sound stimulation, and dietary preparations given in small amounts to maintain the body during prolonged unconscious states. These texts describe what to do when consciousness does not return immediately with a practical patience that is deeply moving. They wrote down what to do during long waits because the long waits happened. Because people lay unconscious for days, and sometimes they eventually woke up, and the community had learned that what you did during those days mattered. Now, let's talk about the archaeological discoveries that make all of this feel completely immediate. Because the evidence of ancient care for unconscious and incapacitated people is not just written in texts. It is written in bones. The Shanidar Blessed we discussed in the illness episode, the individual who survived to old age with severe disabilities in an Iraqi cave 45,000 years ago, also shows evidence of having survived episodes that would have required sustained unconscious care. His injuries were severe enough that recovery would have required extended periods of incapacity during which he could not have cared for himself. Someone cared for him through those periods. Someone administered water and food. Someone kept him warm. Someone stayed. Another remarkable discovery comes from a site in Spain called Atapuerca, dating back over 400,000 years. Researchers found the remains of a young individual with a severe congenital brain condition called craniosynostosis that would have caused developmental difficulties throughout their life. This individual survived to approximately 18 years of age, far beyond what survival logic would predict for someone with their condition in a prehistoric environment. They were cared for 18 years, by a community that had no understanding of their condition, no name for it, no treatment for it, and no practical reason to continue investing in a member who could not contribute fully to survival. They did it anyway, but singing a vase 400,000 years ago, before Homo sapiens even existed. The impulse to care for the vulnerable did not begin with civilization. It did not begin with religion or philosophy or organized society. It appears to be one of the oldest things about us. Now, let's talk about the moment of waking. Because when someone who had been unconscious finally opened their eyes, the response of ancient communities was extraordinary. In prehistoric and early ancient cultures, a person who recovered from a prolonged unconscious state was treated as someone fundamentally changed by the experience. They had been somewhere else. They had seen things others could not see. They had traveled between worlds and returned. In many cultures, they were considered to have a new relationship with the spirit world that gave them special knowledge or special powers. Their descriptions of what they experienced while unconscious were listened to with great seriousness as reports from beyond the ordinary world. In other words, ancient communities were doing what modern medicine is only beginning to do. They were listening to the experiences of people who had been unconscious and taking what those people said seriously as information about something real. Modern research into near-death experiences, the remarkable consistency of reports from people who have been clinically unconscious or close to death across cultures and continents, is one of the most genuinely mysterious areas of contemporary neuroscience. Ancient humans did not have the framework to study this scientifically, but they recognized it. They took it seriously. They built it into their understanding of what it means to be human. And sometimes the person who woke up was the most important person in the tribe from that moment forward. So what did ancient humans do when someone would not wake up? They called the shaman and began the rituals immediately. They entered trances and searched the spirit world for the missing soul. They kept the fire burning and the space quiet and the body warm. They tested carefully and anxiously for signs of life using every method available to them. Feathers held to lips, ears pressed to chests, names called in familiar voices, strong smells and sounds and touches applied with desperate hope. They developed waiting periods and watching systems and elaborate precautions against the most terrifying mistake they could imagine. They built bells into coffins and speaking tubes into tombs, and they stationed watchers at bodies for days because they knew from hard and heartbreaking experience that the line between alive and gone was not always clear. They administered water drop by drop and turned bodies to prevent sores and applied herbs and smoke and needles and massage. And every technique accumulated over thousands of years of watching what sometimes worked. They waited for hours, for days, for weeks sometimes, because the person was still breathing and they were not willing to stop until the breathing stopped. And when the person finally opened their eyes, they did not say, "Thank goodness that is over." They said, "You have been somewhere we cannot go. Tell us what you saw." They listened because ancient humans understood something profound without anyone teaching it to them, without science confirming it, without philosophy articulating it. The fact that someone is still breathing means they have not finished yet. And as long as they have not finished, you stay. You keep the fire burning. You call their name. You hold their hand in the dark and you wait. That is not ancient. That is not primitive. That is not something we evolved past. Every person who has ever sat in a hospital room beside someone who would not wake up, watching the monitors, calling their name, holding their hand, hoping, they are doing exactly what the Neanderthal community did for Shani Dar 1 in that cave in Iraq 45,000 years ago. The machines are different. The room is different. The understanding of what is happening inside the body is incomparably more sophisticated. But the sitting, the staying, the calling of the name, the refusal to leave, that has never changed. Not once in all of human history. And honestly, that might be the most extraordinary thing about us. Not our technology, not our science, not our cities or our art or our language. The fact that we have always stayed. If this hit you somewhere you were not expecting, share it with someone who needs to hear it today. Subscribe for more stories about the humans who came before us, and comment below which part stayed with you the most. I will start. The bells in the coffins, and the person at Atapuerca who lived for 18 years because someone decided they were worth staying for. Still thinking about both. Still thinking about both.